Hello, everyone. Welcome to our panel on COVID and schools. My name is Matt Bateman. I'm the Vice President of Pedagogy at Higher Ground Education and Guidepost Montessori. And we are a network of Montessori schools. We have 80 locations across the world, across the US and Asia primarily. We have at-home programming, pods, virtual learning, teacher training. We're kind of the one-stop Montessori shop. And I'm a teacher and a parent myself. I have a 1-year-old daughter, just turned 1 last weekend in one of our programs here in New York City. And we're delighted to have you with us today. I know that there's a lot of you in the audience who are interested in this topic. A lot of you probably attend our schools and have questions. Welcome. The goal of the panel today is to get some clarity on COVID and schools, what exactly it will take to reopen schools, but also I think we've got these luminaries here. I want to mull why schools have emerged as the locus of COVID controversy. In some ways, schools are the center. They're more controversial than other things in terms of how people think about policy and vaccination and reopening. And we want to answer any questions that you guys have about the situations that you find yourselves in as parents, as educators. So please drop your questions and comments into the chat as we go. So the format here will be 45 minutes of panel discussion, and then we'll say 15 minutes for your questions at the end. I think that there's also going to be some polls and quizzes that pop up, so that'll give us a little bit of information to work with as well throughout the panel. So let me introduce the panel. First up, we have Emily Oster. She is a professor of economics at Brown. She's the best-selling author of Expecting Better and Crib Sheet, and a new book coming in August called The Family Firm, which everybody should buy. I have used her books extensively in my nascent parenting journey, and my wife and I both found them incredibly helpful. And she takes a data-driven approach to decision-making and parenting and pregnancy and education and family decisions. So welcome, Emily.
Thank you.
And then we have Amesh Adalja. Dr. Amesh Adalja is a senior scholar at the Johns Hopkins Center for Health Security. He works on infectious disease, pandemic preparedness, biosecurity. He's advised the US and governments and institutions, and including us, the list is as long as my arm, on a panoply of infectious diseases from plague to anthrax to COVID. Welcome, Amesh.
Hi, thank you.
And then we also have Ray Girn. Ray is the CEO and founder of Higher Ground Education. He's a former educator, teacher, curriculum developer, and he's really been leading our charge on COVID response, including across all Guidepost programming. Thanks for coming, Ray.
Yep, great to be here.
So I just wanted to start with like the nuts and bolts of how you see the narrative. What is the current state of schools, and how have things kind of unfolded over the past year? So we're now a year into the pandemic. And I think where we are now is pretty different than where we started, just in terms of our understanding of things. But I mean, how has this impacted schools in particular? Why don't we start with Emily, and Ray, I know you'll have thoughts, and Amish too.
I mean, how has it not impacted schools is maybe a better question. I mean, I think that the sort of landscape of education is completely completely different than it was. So let me just sort of set stage a little bit for how I saw the kind of what has happened, and then I think others can weigh in there. So I mean, obviously everything closed in March, of 2020, and we had sort of effectively, in many cases, more or less no school for anybody. I mean, I think places tried to do some work and so on, but I think even in very well-resourced environments, it was very little going on in the spring. It was just too chaotic and too difficult to ramp it up. As we got into the fall, there's really a bifurcation, and I think this doesn't get maybe as much discussion as it should. But starting in August, Indiana, Georgia, Florida, they just kind of open their doors, and in a lot of ways open their doors fairly normally. I mean, not of course not completely normally, but there was some kind of in-person education that looked pretty much like the kind of like it had looked before. And then there are places that didn't open in the fall and kind of never opened. And now we're sort of starting to see some opening there. And I think the sort of two big narratives of that we've kind of, if we think, what do we know now that we didn't know in the beginning? I think we've sort of seen two kind of evolutions of narrative, sort of on the one side, trying to enhance our understanding of the risks of in-person schooling and how that can be made safe. And then I think on the other side is sort of a growing set of information about the costs or the risks, downsides, limits of the remote schooling. I think both of those have sort of percolated up over time. I think the combination of those things is why we've sort of started seeing more of a push to reopen. But I think for me, the big kind of organizing principle is just this huge bifurcation where places kind of either opened or they did, like they opened at the beginning or they didn't open, they really didn't open at all. I think one of the things many of us had maybe expected was that we'd see some opening and then we'd sort of, it would evolve over time. And in one direction or the other, places would open and then they would all close, or places wouldn't open and then they would all open. And in fact, what happened is if you open, you stayed open. And if you didn't open, you didn't open. And that's kind of led to this sort of movement apart in a lot of things. So let me stop there.
Yeah, no, that's really interesting. I mean, Ray, how have you seen things, especially since we have schools across the country, even across the world? Like, how have you seen this play out over the last year?
Well, I think that, initially from a kind of operating perspective in terms of school, pedagogy and programming were subordinated to safety. And so it was just like, okay, we to the extent that schools, you're either at home or to the extent that you're on site, everything is different, right? Like all the protocols are different, and then there's an adjustment period, and there's some give in terms of people's patience and even just capacity to kind of adapt in the moment. And then what you've seen is, on the one hand, resourcefulness, creativity, new insights in terms of how do you implement a certain approach to education given the constraints. And I think on the other hand, you've seen devastation. I think it's going to be pretty ugly. The kind of counting of how many people have had essentially a year of lapsed schooling and community and connection, and what does that look like? And I think it's often the most vulnerable populations. And so as an educator and as an education entrepreneur, it's an interesting time. The challenges and constraints of social distancing and the pandemic on the one hand, I think there's been this tremendously amazing response and capacity for response, and it's very exciting in terms of the new thinking that's going on. And on the other hand, I, as someone that's a critic of kind of traditional education, find myself in this strange, odd position of defending school. Like, kids should be in school, and just the trade-offs, I think, haven't been really weighed properly.
Yep. Amish, I'm wondering if you could say a little bit, if you agree with this kind of characterization, like what's going on here? Like, why is it that some schools are open and operating relatively normally, other schools are struggling? Is there a kind of scientific controversy here? Is it a political controversy? Like, how do you see this playing out?
I see it more as a political controversy. So if you look back to March when they closed schools, what was happening at that time is we had a new virus. It was spreading through the respiratory route. We didn't know a lot about it. So many school districts basically took the position of basically extrapolating from influenza. We know that influenza can spread through schools. We know that children magnify influenza. So that's why the schools closed at that point. And there were critics. One of my colleagues wrote a major opinion piece in the New York Times saying this isn't the right decision because we don't have the science to back it. And what we saw is as schools opened in different parts of the country, in different countries, and when they reopened, even some schools actually opened back up like in May, June and finished their school year. I think in Montana and a few other places, public schools open and some private schools. We were looking at the data, we were learning that children, especially those below a certain age, definitely 9 and below, and maybe even higher than that, we're not major transmitters of infection. We're not getting infected. And we're spared from the severe disease. So all of us thought, this is something that we can do. And in Europe, they basically embraced that. They made it the default. They were going to keep schools open, and they would deal with their other community transmission mitigations in other venues, but not schools. It was the default. But that sort of changed here. And it's unclear to me, because even now, the CDC data that came out from Wisconsin showing when there was high levels of community spread, they were able to keep it out of the schools, that the schools were the safest place to be. And indeed in New York City, the positivity rate in New York City was so low, it was much safer to be in school than to be anywhere else, even for a teacher to be employed in a school than it was to be in some other type of venue. So to me, it's never been a scientific issue. I think it's been an issue of comfort level and kind of catering to this perception of what the risk might be. And then I do think it's unfortunately gotten completely tied up in politics, because I'm sitting here in Pennsylvania, in Pittsburgh, and in the Pittsburgh school district is closed. But the surrounding suburban public schools are either open and hybrid or open full-time, or they've got something going on. And the private schools are all open. And I think to me, there's not a scientific reason why the city of Pittsburgh schools can be closed, but the suburb over, those can be open. There's nothing really different about the transmission dynamics that are going on there. And the other point I would make is that many of the schools that closed and went hybrid or distance, they never stopped their extracurricular activities. So they were continuing their sports, they were continuing even like wrestling, which I think is a high-risk COVID transmission venue. And I think that also is interesting, because then people will take that data and say, look, there were transmission in schools, but they don't look and say, oh, that was at sports, that was at cheerleading practice, or that was at that crazy mom who had a clandestine homecoming dance in her garage. That literally happened in the Pittsburgh suburbs. And then they try to blame that on the schools. See, schools aren't safe. But it's actually, I always tell people, if you're sitting if you can sit in your classroom in a desk and learn about calculus, you can't do that. You can't learn about calculus that way, but you can go learn the latest wrestling move in the gym. Or, don't ever set foot in our schools, but don't be late for football practice. I mean, that's basically what happened. So, I mean, this clearly is not a scientific, it's long since been a scientific decision. And one last point is when the CDC director recently, Rochelle Walensky, the new CDC director, said, vaccination of teachers is not a prerequisite for opening. The White House walked that back and said she was speaking in her own personal capacity. But that's the whole reason why she was hired, because her personal capacity is so good to understand these factors. So there's a lot of politics that's tangled into this, and I think it's very difficult. And the Pittsburgh mayor today just announced he got the endorsement from the Pittsburgh Teachers Federation, and he's not been pushing the way certain mayors have been to open our schools here in Pittsburgh. So I do think that politics plays a major role in what's happened here, and the science is fairly well settled.
I mean, what do you think about this question? I mean, just Emily, you've collected a lot of data. You've been kind of like collating and gathering and interpreting data about schools in the pandemic for almost a year now. Like, I mean, how do you see it? Do you think it's pretty unequivocal? Like how Amesh is describing it, has our understanding evolved? Like, I'm just curious as to your thoughts here.
Yeah, I mean, I think so again, I sort of step back to like in the beginning of the pandemic, in this sort of early period, I think that there even very early on, there was a sense that kids were kind of not like a very high risk group. Even we got like very early data from China. But I think there was a huge amount of uncertainty among like people who knew things early in the pandemic about just how big a deal schools were going to be, how big a deal kids were going to be in terms of spreading the virus. And I think part of that comes from like, if you are a person with young children and your young children go to school, they get sick a lot and they bring it home. Like, kids, I mean, things like flu, like the flu is definitely spread in schools. That's like 100% true. We know that to be true. And other colds, norovirus, all this kind of stuff. And so it was very easy to be in the mindset of like, okay, schools are going to be not just a place where someone could get COVID, but sources of tremendous spread. And I think that when we came into the school year, there was still some of that, even though I think we should have learned from Europe, we should have learned from what happened in daycares and camps that opened, and in fact, it was possible to do this safely. I think there was still a feeling kind of coming into the year, okay, we're going to open these high schools in Georgia. Look at this picture, all these kids standing in the hallway, not masked. Like next thing you know, thousands of cases of COVID, and that didn't happen. I think for our data, some of the data that we collected, a lot of the other data, other people did sort of careful jobs. I think the first thing was just, we don't have super spreaders, and then the data started becoming in some ways even more reassuring. Like, okay, well actually, like very few people are getting it at school. Forget about not having giant clusters. Like we're just not seeing much spread at all. And I think part of that is the sort of lower risk of kids, and part of that is that it's just a really controlled environment. I mean, I think as Amish said, like, you know, wrestling tournaments are one thing, but like people sitting around kind of in a like somewhat high anxiety state in the middle of math class wearing a mask all the time, it's actually not a super high risk environment, it turns out.
Yeah.
In the city of Pittsburgh, they had no qualms opening the casino, where we were getting super spreading events at blackjack and poker tables. But when you try to open a school, it became impossible.
No, and I think you also, I mean, I think part of what's sort of been frustrating for I think many of us about this is it's, you know, it's one thing to say like, look, our attitude as a society is going to be no risk is acceptable. We're just going to close everything and we're going to just completely stay locked down until 100% of people are vaccinated. Obviously didn't take that approach. And so then just sort of feel like basically it's fine to have casinos, it's fine to have, you know, gyms, it's fine to have, you know, 80% indoor dining, it's fine to do, but somehow schools are like the end of the road, sort of the opposite of the position that Europe took, which is like, you know, schools are last to close, first to open. We're kind of in the other side. I think that I have found that really frustrating. You know, there was something the other day about some large spread events at gyms where people were, I don't know, they came sick, they did an indoor like high intensity exercise, whatever it was. And, you know, people reported that as like, oh, it's important to remind people to wear masks at gyms. And I just kept thinking, like, if you said this about, if this article was about a high school where 30 people got it, and I think people would be like, that's it, we have to shut all the schools down. No one would sort of say, oh yeah, well, just try to wear a mask. Don't come to gym sick.
So just a quick interjection. If you're coming in a little bit late, we're about 15 minutes into what we'll be doing this for another 30 minutes, a panel discussion of COVID in schools, and you should put your questions in the chat because we will start getting to them after we're done with this part of the discussion. I'm kind of riffing off of this. The concern. The debate, I think, has shifted pretty significantly over the year, and it shifted pretty early. I think by last summer, it was less about our children safe and more about our teachers safe, our parents safe. Like there was a kind of public assimilation of the fact that, okay, like children seem relatively low risk here. It's really about how it fosters kind of other people in the community, and the two stakeholders are parents and teachers. And I'm just wondering if you guys have any thoughts on kind of like how does what you say apply to teachers in particular? And maybe Ray, I don't know if you have any kind of particular thoughts or expertise here, but you can just say a little bit about how we've thought about this issue.
Sure. A very quick point that as a kind of layman just trying to educate myself, and I think of, you know, June, July, August, it has been extremely difficult just to even get, you know, a clear and coherent sense of, you know, what are the numbers, what do they mean, you know, even just the way that the age bands are distributed when you go and you kind of download the spreadsheet and try to figure it out yourself, like, and so there's something to say here about just why is it so hard to process this information, because once you do dig into it, it does seem kind of fairly evident. Our view, we optimize for choice, right? And so our view is that we're not going to prescribe or make judgments about particular people, particular educators and their views, and we're going to try to kind of accommodate the ability for individual human beings, and in our case, our staff, to make their own judgments. But we as an organization have a certain risk assessment. We think that if we put in the protocols and the practices that we need to, we can sufficiently minimize the risk, and we have seen that play out. Like there, you know, it's gone really well across 80 schools, you know, down to the kind of classroom. But this was at, you know, 300 classrooms or so. And people have made their choices, you know, and you know, and then we've tried to find solutions. You know, there is virtual education going on. There is ways to accommodate, you know, high risk staff that really can't be at school, and there's all sorts of programs that support it, but generally we've taken the position that, like, you know, we're open, and we are not forcing anyone to come. You know, we're here to help if you don't want to for whatever reason, but you know, we organizationally made the judgment that we can create a relatively safe environment, and nothing is zero risk, but, you know, reasonably safe environment. And again, as far as I've seen from the numbers, you're talking about, like, you know, you're talking about 1 in 10, 15,000 kind of infected infected, patients suffering anything significantly serious, let alone just in the total population. And we've seen that play out. Like we've had to close a classroom here, a classroom there for 2 weeks, and we've done that and turned it into a science, and it's been very effective. And it's even hard for families for those 2 weeks. But I think only one case that we even have to close the entire school just because the sibling dynamics meant that 4 or 5 classrooms kind of were exposed, and we did that, and parents have been accommodated.
Amish, any thoughts on risk to teachers?
Yeah, so I think an important topic to consider. And there definitely are going to be high-risk teachers, and they're reflected in our priority groups for vaccination. So, for example, if you're a teacher above the age of 65, you would be priority group 1A in most states, or if you've got conditions, they are getting vaccinated. And I do think to make a teacher safe, there's certain best practices: social distancing, mask wearing, hand hygiene, making sure that the teachers themselves are wearing masks and face coverings when they're interacting with each other in the faculty lounge or whatever it might be. We know how to do this safely and keep teachers safe, but sometimes that's not the issue, because, for example, in some school districts, they'll say, teachers, if you don't want to come, let's have our students back and we'll have classroom monitors and we'll just teach you remotely. But some teachers unions have blocked that from happening as well. So they can stay at home and still do distance learning, but the students are in the classroom with the classroom monitor. So to me, I think some of this is getting there's a little bit more to it than just teacher safety. And I think getting teachers vaccinated, I think is going to be great. I think it didn't need to happen to open schools. We've seen schools open safely without it. But now that that's taken off the table, I think I'm just worried about I'm waiting for another shoe to drop, and that there's going to be something else that needs to be done before we can get schools open again. But I do think that, I think teacher safety is something important. I think that they should be considered essential workers. And I think school districts have to think about, the other point about school districts is, they exist to teach students. That's what those schools are about, that they were created to teach students, not to employ teachers. And I think that's also something that's kind of gotten a little bit twisted, where the schools are not able to fulfill their mission. And so then I think they have to rethink how all that works. To me, I think it seems a little bit backwards what's going on. But I think it's not always all about safety, but I think safety is important and has been handled pretty well.
I mean, one of the kinds of arguments, narratives that you encounter is that there are differences in schools in terms of how they can resource, the like ventilation, keeping windows open, supplying masks, actually enforcing social distancing, having the space required. Like one argument is like, our school can't do that, and to kind of like, make teachers come in kind of in these circumstances, it's not actually safe. And so like the kind of rhetorical move is kind of like, yes, like we agree that kind of if you can make things safe for teachers, teachers should come in and teach, but we're questioning that you've done that. I'm wondering if you, Amish, Emily, if you guys have thoughts on that kind of view.
I think what I would say is, there are more and less safe ways to open, and that the places that have opened successfully have, for the most part, taken at least some, mitigation strategies seriously. And when we've seen transmission, for example, in this big study in North Carolina, we saw small numbers of transmissions in schools. They tend to be when mask protocols are kind of relaxed. So, there are some basic things. I think, Joe Allen at Harvard talks a lot about about filters, like ventilation. There's some stuff that I think we can, that can make school reopening safe. But I think we can take that a little far in the sense of sort of saying, well, it's only to open if you have a tremendous amount of set of resources. And I think that's not true. Like a lot of districts have opened in places that are not, they're not super heavily, not super high. And we've seen, for example, even in some large urban districts where the public school districts have not been open, we've seen, the archdiocese be open, serving a very similar population in terms of demographics. And serving them in a way that's that seems to be safe and has sort of minimal outbreaks. And so I think that that there's a sort of simultaneity of, like, when we say we open, we should mean open safely, and that should mean that everyone wears masks all the time, and we're sort of careful in those ways, but without saying it's only possible to open if you're a $70,000 a year private school who can, give everybody their own hamster bubble. Like, I don't think we need to go. We don't need to do that. So.
Yeah, I'm actually curious, just to follow up with you, Emily and Amesh. I know you've both said things about this. I actually don't know where things stand right this second, but a month or so ago, the kind of updated CDC guidance around school opening was sort of confusing. Like it was like school should open, but here are the standards in which they should open, and then like you kind of look at the map of that, and it's like, what does this mean? Like basically nobody should be open. So should they be open? Should they not? Like, are we misinterpreting this? Like, can you help me understand that?
Yeah, so I'll take it first. So I think the CDC guide, it was good to actually get guidance because and most of us were anticipating something stronger than what they actually put. We thought they were, after we'd heard the CDC director talk and about how schools should be open, and Dr. Fauci said the default should be schools to be open. And then what we saw was this guidance that had this idea of looking at community prevalence when the CDC themselves proved that that didn't matter, because their studies had shown when community prevalence was high in certain places, it didn't impact schools. So that to me was baffling. And a lot of people think the CDC sort of waffled on that or was managed or handled by that on that point. And I think that's been a big frustration for opening schools, because now, as you said, if you look at that community prevalence map, it means only 4% of the counties in the country could be open. And that's actually not true. So hopefully that gets revised. I know the CDC is coming out with new community mitigation standards that are not out yet. I think, again, even in this, the CDC was completely handled and throttled by the Trump administration. But I even think there is a little bit of politics going on in the Biden administration, as well as we saw with the teacher vaccination issue. So this was disappointing to many of us that they didn't use their own data to make that statement about community prevalence and school prevalence being disparate.
Yeah.
Yeah, I would echo that. I think that, there were a lot of things I liked a lot in that report. I thought there were pieces of it that were great. And then there were some pieces that I just found confusing. And I think the community prevalence cutoffs were confusing just because the sort of messaging coming out of the mouth was all the places should open. And then when you looked at the numbers, it's like, but your own numbers say that. And in fact, it was so confusing that I had I was saying the CDC guidelines are very stringent. And yes. I think that I think for me, part of it is a little bit of a worry about the fall, and sort of like the way the CDC guidelines are written now. There are a lot of places that couldn't open in the fall because of some of the distancing stuff. So, I anticipate that there will be some changes to those, particularly in light of the fact that at some point all the teachers will be vaccinated. But I think, we're going to need to make sure we revisit those. Otherwise, we're going to be in another year of this.
Do you think that that's in the cards, that we're in for another year of, just one kind of basic question to ask is like, it sounds like you're all saying school should basically be open now. And that it doesn't feel like, that's where, it feels to me like we're kind of getting there, but there are countervailing forces. And just where do you see this headed? Like Amish, you expressed some worries about moving goalposts.
I think that's definitely the case, because if you look at the medical community, the American Academy of Pediatrics, the Pediatric Infectious Disease Society, who probably are the best experts, all of them unequivocally in support of schools opening now with mitigation measures. But that's not trickling into our policymakers, the ones that are supposed to be following the science. It's very strange to me, this disconnect that's happening, that all of us are mostly saying the same thing and have been for some time. And I do worry about shifting goalposts. And I think it has to do with the way people perceive risk now. And I think that some people think that COVID is going to go away, that we're going to get to COVID zero, but that's not going to happen. This virus has established itself in the human population. We're going to have COVID 3 years from now. There are going to be cases, but COVID is going to be basically tamed. It's going to be defanged by the vaccines and never able to cause serious disease, hospitalization, death, or threaten hospital capacity again. So people have to move forward with risk calculations and mitigation measures and trying to learn how to live with this virus, versus what we've been doing is basically abstinence only. I'm borrowing that from HIV, that we that we knew that that type of an approach failed over and over again. And we never really got the population ready to make risk calculations. They basically were trained to go to abstinence only. Zero risk is what we were looking for. And that's just not going to happen. This isn't going back into the bottle. And I think we can't allow them to move goalposts for the fall. I think if they take another school season out, I think it's really disastrous. I think it's the end of public schools, and especially for economically disadvantaged students, they're not going to catch back up. And we know that that correlates with lifetime earning ability and lifespan. So, I mean, these are real problems that have to be solved like now.
Ray, do you want to just kind of piggyback on that, just in terms of like just the value of schools, the importance of keeping schools open with other options? Like I mean, say a little bit on why.
Yeah.
Like you were defending traditional schools, even though you're a critic of the system. Like, why does this matter so much? And
yeah, so there's a lot of different ways that the whole landscape could be kind of evaluated. I would just say, looking at it so there's this kind of cynical approach in terms of, okay, look, are teachers being paid if they're at home? You know, is there how are the incentives lined up? And you can kind of take that lens on it. But I think the more helpful way to look at it is the issue of parent choice has just become central. Like we're talking about the extent to which you exercise the precautionary principle, but who? Like, you know, should each public school be deciding, you know, should the principal of that school be deciding the policy locally with respect, you know, to that school, that community, those families? Like, you know, there's a question of like, you know, whose risk judgment, right? And again, our approach has been with staff and with families that we want to accommodate individual parents, because we're premised on this idea that education is delegated parenting. Education is parenting delegated to a professional class who, you know, who has an expertise. And on that view, the question comes back to like, what does a particular parent want for their child, and what is their tolerance? Some people are going to I'm going to restaurants with my kids, right? And taking certain precautions. I have friends that are like, no, we're not going to restaurants until, you know, there's more of a kind of penetration of the vaccine. That whole way of looking at it has been removed. And I think that then, you know, you're setting policy for the entire state or the entire country, and that's part of the problem, that you know, that you're not allowing for individual variation of risk assessment.
I mean, I think that like part of the problem has been, I could definitely see what you're saying, Ray, and I've seen it play out at our schools, and I agree. But part of the problem has also been the opposite in a certain way. It's like, we don't have a kind of view as a society, or even there's not even kind of strong univocal leadership. Even now, I don't think that there is, on like, how do you think about the pandemic? Like what is going on here? Like, I mean, schools are a flashpoint, but like in New York, it's like restaurants are closed, restaurants are open, like schools are closed, schools are open, different policies for the subway, different like it's not, and at no point is it like, here is the explanation for these thresholds. Even with the vaccines now, you see things like, I mean, Amish, I know you've been involved in this. It's like, okay, like when we are vaccinated, will we still have to wear masks? And people are like super hedgy about it, and kind of like go back and forth, and they're scared to say different things. And it's just, there's just a kind of lack of strong directionality. And sorry, I'm a moderator. I should.
Yeah. Well, I'll just say like that's the point, you know, in terms of the perspective, the vantage point from which you want to analyze the issue. You know, from a kind of scientific perspective, I mean, there's a generation of children suffering intellectual privation for no reason, as far as I can tell. And I think that that's an objective view. And it's really, you know, our lack of ability to evaluate the trade-offs culturally is itself an indictment of our education system, right? And so I strongly believe that. But I as an operator, as an educator, I think that somehow has to be coupled with the fact that you want to limit the extent to which you're imposing a certain approach on everyone, and maximize the extent to which people can make their own judgments. And so I tend to default to that view on it.
Do you have views on this?
So I have sort of two thoughts on that, this kind of personal approach. So, I mean, I think one is it really is everything about that we're going to have to re-enter. And I think we're going to have to recognize emotionally that the first time you do something that you haven't been doing, it is going to be scary. And that you can sort of evaluate, is it safe, is it not safe? Like, how do I evaluate this risk rather than other risks? And, as the pandemic goes down and more people are vaccinated and so on, it's going to get safer, which is great. But you're still going to have to consciously, I think that, like, I have not been to an in-person indoor restaurant since March 3rd, 2020. And I'm not going to go until I'm vaccinated. I know that even once I'm vaccinated, when I go, I'm going to have to sort of switch my brain and be like, okay, no, it's okay to do this, even though you're afraid. And I think that comes up in schools. Like, the first week my kids went back, it was like, oh my God, like, this is really scary. Like, what's going to happen? And then you sort of get used to it. And I feel sort of over and over again. So I think we're going to have to train a little bit to kind of figure out what's safe, but then to overcome that piece of fear. The other thing is, when we get to the fall, even if schools are open full-time, in person, regular school, everybody can go. Not everybody will go. Because there are still going to be people who don't want to send their kids. If their kids aren't vaccinated, we're just going to have to recognize that aspect of parental choice, and we can try to make it so everyone wants to go, but they won't. And this is something that we are going to practically have to address, because it is very difficult to simultaneously teach in person and hybrid and on Zoom kids. No one is able to do that successfully. Nobody at no people. This doesn't work very well. And so I think we're going to need to figure out, people who have opted for something virtual, I think we're going to have a better sort of virtual academy, all Zoom school setup, which some states have done better. I don't think this thing where, like, the classroom teacher is responsible for both groups, if we were trying to do that, that is going to be a barrier to reopening. In the fall, we need to remove that barrier by coming up with something else.
Yep. Do you have any thoughts here, Amish, just in terms of, like, schools in relationship to the kind of general pandemic response, just our kind of ability to think about, this is your job, like, to educate the public about these risks. And, I think that there have been mixed messages. There's still controversy. Like, I'm sure you've got colleagues that disagree with you about the relative safety of schools and, what you can do once you get vaccinated. And, like, how do you approach these issues?
So I always start with trying to think about risk calculation and realizing that people have their own values that they pursue. They've got a hierarchy of values, and they have to judge everything they do against that. So even early on, I said, when people are going to do things, you might disagree with it, but they're making risk calculations based on what's important to them, what's essential to them. And you can't necessarily take your own value hierarchy and graft it onto someone who really wants to see their grandmother or really wants to do something that might be a little bit more risky. So I've always been about trying to give people tools for risk calculation and move away from that never do this, never do that abstinence only approach, and really going from harm reduction. And maybe because I'm an infectious disease doctor who has to take care of HIV patients or patients who inject drugs or sexually transmitted infections, where I'm always counseling, I know you're going to do something risky, but these are some common things you can do, easy things you can do to decrease your risk. And we know that works. So I've always taken that approach with people, trying to meet them where they are and try to make their whatever activity they're trying to do a little bit safer. So if they say, I want to do this, I'll say, maybe do it outdoors or open a window, or who are you doing it with? Or can all of that type of things, all of those types of variables, I think make it much more palatable to the general public, because we're in our field of public health and infectious disease, we're losing our connection with the audience. We're people aren't trusting us because of that, because they're doing things and we're saying, no, don't do that, and not giving them any kind of help to actually do things safer. So that's how I've approached this entire thing, is just trying to get people to risk calculate. And finally, people are starting to do that. We're seeing the CDC guidance start to lift for what vaccinated people can do in terms of they don't have to quarantine if they're exposed. Gatherings with other vaccinated people, the CDC says, are okay, even though we've been saying that from the very beginning. It just takes some time for the CDC to catch up. And I think you're going to see more of that. It's just that the public health guidance, they're often incentivized to take the most conservative approach because they don't want to get burned. They don't want something, they try to make it as least risk. They're very risk averse. And I think we don't do that as doctors with individual patients. We talk them through and try and give them a toolkit. And I think that's been missing from this entire pandemic. And that's what I've tried to do when I talk to the public, is take what I talk to a patient when they're telling me I'm going to do X, Y, Z. I try to translate that to the general public. And it's not common in our field. It's starting to trickle in now, finally, but there's only maybe 5 or 6 of us that have been doing it extensively through the pandemic. And we're sort of a little bit of anomalies and often take a lot of flack for it.
Yeah, I mean, there's a kind of there's almost like a systematic like WebMD effect where it's like, I'm going to Google these symptoms, and WebMD comes up and you're like, they're telling me that I should get checked for cancer, and it's like a headache or something, and they're like, why is that? Well, it's like they get millions of visitors per year, and like they have to kind of give the most cautious, conservative, advice possible. And I know that you and Emily in particular have taken like such a, I mean, this is part of the reason why I wanted you both here and admire you both, is that that's not the approach that you take. What were you going to say, Ray?
I was just gonna say it extends to parenting and education, and part of the reason that I've been pushing for the type of approach Amish is talking about in terms of respecting kind of risk preferences, but also really considering taking seriously kind of the trade-offs and being a little bit more tolerant of risk in a reasonable way. The reason is because we take that approach to parenting generally. Like we're saying, let your kids walk to the park, and like don't back off a little bit. Don't keep your kids in a bubble. It is not inconsistent with the broader Montessori approach, where it's like you cannot be on the premise of eliminating risk for your children, even leaving aside the fact that the risk here is marginal or minimal. Like that there's something in a sense that's of the age that we're pushing against, and the kind of COVID example is an instance of something broader.
Yeah, I mean, I'm going to switch to audience questions in a second, but just one quick moderator's privilege comment, which is, I mean, when we're talking about COVID and education, I often wonder what children of various ages are absorbing from the kind of like the public discourse. Like there's a perspective that we're taking as caretakers and as a society on how to handle this, and children are noticing, and that they're noticing, they're absorbing, they're evaluating, sometimes implicitly, sometimes explicitly, and like something is being learned here or rejected, and that I think is worth thinking about too.
It's interesting because when I was in elementary school or through K through 8, ironically at a Catholic school, we had fallout shelters, and we had to do these duck and cover drills because we thought we were going to have a nuclear attack from the Soviet Union. And I don't know if how that would go over now. I mean, they do active shooter drills in schools, but I mean, I think there's just a difference in risk tolerance now, and I think than what it was in the 1980s. It's just completely that's a little bit baffling to me how it's all kind of changed. Even when you go in to visit a school, how different it looks than when I was there.
Even how things like, can your kid walk home? I mean, I live, a few blocks from my kid's school, but like, the fact my 10-year-old walks home by herself is like, like very unusual, even though.
And they all the latchkey kids became extinct.
Yeah, I mean, yeah, exactly. And then like when she gets home, there's somebody there. It wouldn't even occur to people to not have somebody at home. Whereas I just like by second grade, that's it. I'm coming home and get my snack.
I think what you both are talking about, and this is fundamental. I think there is an impact. And if you're conveying, just like if you talk about stranger danger, and all you say to a child is, be wary of people that smile at you, that stays with them. That is an orientation towards other human beings and whether they're values or threats. And I think the broader point, similarly, the attitude towards risk, I do think it's being absorbed. And I do think that this is not the type of mindset that makes you want to go out to the Wild West and figure things out and discover things. There's a certain conservatism that is being forwarded, if not as an ideal, at least as kind of the way to be to children.
Okay, we've got some awesome audience questions, so I want to give them a platform. So we've got Beryl from Ohio, who is a school board member, a parent, and an attorney. And she writes in, I feel there are so many people who have had information overload regarding COVID-19 this year. Do you have any ideas about how to best communicate why policies look different now without continuing to overload parents with information and without feeding the narrative that decisions are not grounded in science and data?
I think for me, I mean, in some ways, one of the biggest mistakes we made at the beginning of the pandemic was failing to articulate when we were uncertain. So there was a lot of like statements which were made as if like, we know for sure, blah, and it was in both directions. Kids don't spread COVID. Okay, that's not true. Or like kids spread COVID more than other people, also not. So like, and as opposed to sort of saying, here's the data that we have, here's why we're still uncertain, here's kind of how we expect that to evolve. That's gotten us into a situation in which people are sort of like, why would I trust you? You're a bunch of like, you're always, every week you say a different thing. And so, but I do think there's still a possibility here when we sort of communicate to say like, look, hey, this is why, this is what has changed. And this is what we are still planning to learn. And, here is what the best data says we should do now. But I think that piece of it, that like, why are things changing? We're too reluctant to explain to people.
Yeah, and I wonder, Amish, if you have any thoughts on this question of, I think part of the complexity and part of what has driven this whiplash feeling is that the discussion has been politicized. And I think part of what people are looking for with advice like this is like, how do we de-escalate the politicization and kind of like, do you just kind of like ignore it? Do you kind of talk about it in a matter of fact way? Like, what do you do to kind of get underneath this and connect people to reality?
I try to build up the case. I try to show the people the data and what we learned, how the context of knowledge has changed throughout the pandemic, why there was uncertainty, where that certainty has increased, what the next questions would be. And then I think people can then see where the politicians have fallen on this and seeing, is it actually falling the way the data is showing, or are there other things at play? And I think most people can figure that out if they haven't already made up their mind. And one of the things that some of my colleagues and I say is that we were doing okay with getting schools back open. I think that the dialogue when the American Academy of Pediatrics released that, and then Donald Trump sort of endorsed it and said, we want schools open. And that caved the entire process because if he said it, it had to be wrong. And then I had to go on TV and say, a stop clock can be wrong twice, it can be wrong twice. I had to say, you had to say that just because he likes it doesn't mean you have to now automatically oppose it. And that really was happening. And it happens on both sides. For the Democrats, for a Democrat idea, a Republican doesn't like a Democrat idea. But I think that really tanked the whole school opening thing, because then he got into a standoff with the unions and it just became, and the unions didn't like his education secretary. All of that got sucked into it. So I wish he wouldn't have even engaged in that whole conversation. And I think we would probably be having a very different web. We might be having this in person at one of your schools. I don't know.
Yeah.
I would just say a couple of sentences, which is that something that's primarily related to policy or politics, you're not politicizing it if you're looking at it at the political level. This is a political issue. I mean, I think, as far as I can tell, like it's pretty clear if you're kind of looking at evidence, what should be done, and that comports with kind of what I generally know about children and about people and about history and the way people have reacted to other crises. And so obviously, part of the issue is like, where is that coming from? Well, why would somebody else believe the opposite view? What's going on? So I think that yes, let's go for simplicity. But if a phenomenon is primarily political, like you have to some extent analyze it at that level if you want to understand it.
Thanks, Beryl, for the question. We have Katie in North Carolina, who is a stay-at-home parent and former teacher, who asks, do you think that surveillance testing of asymptomatic students is worth the cost to schools and school districts? And if so, under what conditions?
I think that it depends on the school district and it depends on their resources, but I do think it's one way to decrease risk to almost a negligible level. We saw what the National Basketball Association and the National Hockey League could do with testing, but I don't know that you need to do that in every school. I think you could do pool testing or random sample testing as a way that's more feasible, especially as test kits become cheaper, and you can use the antigen test because they're telling you what's important, if someone is contagious or not. So I do think you can use this in targeted fashions, at least while prevalence in the community is high and there's not vaccinations and teachers aren't vaccinated. I think as we get more control in the community, as more teachers are vaccinated, you can maybe back off of that. I think one of the biggest flaws in our whole pandemic response is we haven't had testing for everybody for anything they wanted. We should be able to test for this the way we test for pregnancy. People should be able to do this at home, and we would have been in a much better place if we could have tested early on so people could know their status. But I think, yes, I do think this is something that schools can and should try to do to make people comfortable about going back. And it will give you a lot of situational awareness of what's going on in your school. And you have the data then to prove how safe your school may be.
Yeah, I'm a huge fan of testing. I think we should be doing, I think we should be doing it. I think we should do pool testing, like schools should be doing pool testing once a week. We should follow up. There should be a protocol, the pools, the Benex, kind of combine them. And I think partly because it will catch some small number of cases, and partly because it would provide people with reassurance, teachers, students, like just in general, sort of, and some of this, kids aren't vaccinated. Some of this may continue into the fall in terms of the need for testing. And I think that, I happen to live in a location where testing is really available. And, my kids woke up this week with their stomachs hurt, even though there was no, so unlikely that it has anything to do with COVID. I just took them to the zoo, drive through the Benex, then you have the negative test result. And then, the sort of reassurance that is delivered by that kind of testing availability, which not every state has, is really worth a lot. And I think that putting that into schools, we're just going to feel better.
And Cornell University was very aggressive with testing in their student population, and one of the success stories for universities, which had really been rife with cases because of all the extraneous things.
All of these, we're testing, our Brown is testing every student twice a week. Every person around campus gets tested twice a week with the, nasal swab. Good.
Great. We have a question from Shannon in California, who is a PTA president. She asks, what can parents do to help guarantee children the option to be on campus? All of the medical and educational experts agree about the value of school, but as she puts it, the logistics are holding things up. She's wondering what you can actually do.
I would say be vocal, and I would hold your politicians to task. I wrote a letter to, I don't even have children, but I wrote a letter to my school board representative, which fell on deaf ears. I didn't get any reply back saying I'm willing to help. I think being vocal and actually holding people to actually deliver the product that people are paying taxes for, that's guaranteed in most state constitutions, that they're going to have this education system. I would think that the parents need to get more politically vocal. Because that's what's driving this. Like Ray said, if you analyze it at a political level, it's who's driving these decisions. And there were places like Chicago and San Francisco, they got aggressive and it worked. I think they opened. But I'd be curious to see if Emily has any different strategies.
No, I think that's about what it is. I think it's I think part of what is enormously frustrating for a lot of parents is just the feeling of this is just not something you control. And the advocacy and the being loud and being vocal is something that you can do, but ultimately the political, in some places the political factors here are really really hard to surmount.
Ray, I'm wondering if you have any thoughts for parents. All of our parents are obviously attending private schools that are open, but just how you kind of think about advocacy here as a parent and decision making.
Yeah, look, I think there's a lot you can do as a parent to solve the proximate problem for your child. There are creative programs, there are micro-residential programs that are being launched all over the place, some better, some not. You have to be discerning. So you're gonna have to all of a sudden do a lot of work as a parent where you maybe could avoid that in the past. I would say think fresh about settled issues, revisit whether money should follow the child or whether it should go to the institution. Even if ultimately you're going to end up at the same conclusion, that creates a type of pressure as well. And we've seen places where people are asking for refunds of their taxes, and we've seen places where there's been real change in terms of the kind of regulatory framework, where we may start introducing our private school in various private virtual school, which is unique in that we're using physical materials and we're trying to solve the problem that's typically wrong with just the screen time. We think we're going to be able, by September, we're going to be offering it to public school families, many states funded by the state. And so that type of thing, one, I think it's a positive good. But even if you disagreed with me that it's a positive good, it certainly is a way to create pressure and have a kind of return to normalcy, because the pressure is all in one direction. As I said, there's a lot of people comfortable with kind of this extending out, right? And often they're the people that are loudest voices.
Thank you, Shannon. We have a question from Mark in Pennsylvania, who is a parent, and this is one of the questions that we get the most as people running early childhood Montessori programs. What's the data on masks for toddlers? And how do you weigh that against the drawbacks?
There's probably not very strong data on masks in toddlers because the data on masks have to do with compliance. And you might find some 2-year-old that can be really good at doing it, but probably more likely than not, they're not. They may be eating it or licking it or whatever whatever they do, or pulling it down a lot, touching their face a lot. So, I mean, I think that there's probably less yield in doing that, and it's probably just a pain. I think there are alternatives with face shields. You might find it if you've got a toddler that can wear a mask, that's fine. If he or she likes it, or you've got one that they like that they'll do, that's fine. If some of them might want to wear a face shield, I would recommend that if you can do it. But if they don't, I mean, I don't think it's the end of the world. I think the transmission from a toddler to an adult is very, very low. I think even the toddler to toddler is probably not that much. I actually had to do like an informal case contact investigation at a preschool, and I actually figured out that it was the teachers giving it to each other. Then they were blaming it on 2-year-olds, but I started like mapping it out on a little piece of paper. I'm like, there's no way these two teachers are doing something with each other, which I might have actually uncovered an affair on accident, but I looked at the contact trace and I was like, these 2-year-olds aren't doing this.
I want the film rights to that. Do you have any thoughts on masks and very young children, Emily?
Yeah, I mean, I think it's after about kindergarten, it seems like they can cope with this totally fine. I think that, and then under 2, this is not a great thing. The question is sort of, should the like 2 to 4-year-olds be wearing masks? I think if they can do it, that's great. It's my guess is they're better at it than most of us anticipate. Although very little kids, there's this sort of training aspect that may be hard.
Or maybe you get them Halloween costumes. I was
What?
gonna say, give them Halloween costume masks. They might like to be Darth Vader for the day in school.
Right.
Yeah. And is that, I mean, just to kind of like get at the question, the question is about data. Like, is there data on like benefits, or not really? The data just doesn't exist.
Just not, I mean, I think with a lot of these things, it's like that's a really low risk population. So it's already like the toddlers are not getting a lot of COVID. And so then, if you sort of overlay, like now I have to correlate the tiny amount of COVID with whether they were wearing masks in daycare, I think that's just really, we just don't have bandwidth on that yet.
We have 2 minutes left, and we have some great audience questions that would take way longer than 2 minutes to answer. I'm just scrolling through them right now. Let me ask this, and maybe Ray, you can say something about this to close this off. What happens if my child displays symptoms of COVID at school? My child has allergies, and I can't afford for him to be sent home anytime he sneezes. How do we handle that?
Our protocols are on our website, and they're a little bit, could be different state by state, but we are dealing with this trade-off. Like, we have places where our actual customers or parent community feel like, okay, the whole school should be closed, right? And then there's other places where it's like, wait, everything else is open. Why can't we come back a day or 2 later when it turns out not to be COVID? What do we have to wait? Generally, like, we have no choice, and we think it's the right thing to do to kind of take that type of risk seriously. So if your child is displaying something that could reasonably be a symptom, or you are when you're dropping off your child, we have to treat that seriously, and we're going to try to provide you solutions at home and other things, and we will be fairly quick to shut down the classroom until we're clear. But the exact specific policies and protocols, we have a lot more internally, but we have some public facing ones on our website.
Great. We are right at time. So thank you so much, Ray, Amesh, Emily. This has been super, super helpful. I am sure some people are asking me if the recording will be shared. I'm sure we will be posting this all over the internet as soon as possible. So links will be shared out if you registered. And one quick thing is that if you asked a question, especially if you're a guidepost parent and we didn't get to it, somebody will reach out to you just so you get your specific question about your specific circumstances answered. Thanks, everyone.
Thanks. This is great.
Thank you.
Yep. Bye.
Bye.